This podcast is brought to you by the GRC Insights Division. I'm Mujtama Najib, and I'm a sophomore majoring in global health and neuroscience. Today, I'll be interviewing Atrik Patel. Atrik, you want to introduce yourself?
Hey everyone, my name is Atrik Patel, and I'm a second-year student here at Northwestern University, and I'm studying neuroscience and global health.
Thanks for the introduction, Atrik. Now, today we're going to be talking broadly about global and public health. And what I'm wondering is there any issue that you find to be incredibly important concerning global or public health that may have been, may or may not have been emphasized by the current pandemic situation, but just something that you find really important to talk about, or some component of global or public health that you find to be, really significant?
Yeah, so there are actually a lot of issues that I've learned about in these past few years, and it's kind of difficult to just choose one. But I would say that one that comes to mind that is important to consider is the idea that there are significant social determinants of health. And to describe this issue more generally, social determinants of health refer to social conditions that individuals experience that impact their health. And these could be environmental, they could be economic, or they could be related to concerns of accessibility or otherwise. But in general, these determinants are broad social factors that are important to consider when we are taking a look at why health disparities exist in our communities and what can be done to address them. And I would say that the pandemic has really highlighted the impact that these determinants have on the health and well-being of our communities.
That's a really interesting topic that you bring up. And at the end there, you mentioned that the pandemic really shows these things. What I'm kind of wondering from that is kind of in what scenarios relating to the pandemic do you find these social inequities to be, observable by, I guess, like the greater population? And like, I guess, in what areas do you find them to be like particularly emphasized? Yeah, go ahead.
Yeah, that's a great question. So, I think first and foremost, it's important to understand that the pandemic is not a form of a great equalizer. That's sometimes a phrase that's thrown around. And of course, the pandemic has significantly impacted the lives of many people in the United States and across the globe, but it really isn't the case that it has affected everyone the same. So even if you were to just take a look at COVID-19 infection rates, the National Urban League reported that Black Americans are close to 3 times as likely to contract the virus than white Americans. And statistics like these are pretty shocking, but they are in no way solely reflective of the realities of the pandemic itself. And the pandemic actually just serves as a mirror. It reflects back the presence of broad social determinants that contribute to health disparities. And these disparities are not a consequence of the pandemic. The pandemic has just exacerbated them to the point that they can't be ignored.
And so you mentioned that that these kind of issues and social determinants of health are not at all exclusive to the pandemic. That they've kind of implying that they've kind of been here for a while. Uh, what do you think are the personally or historically have caused these issues to be propagated over time? And what actually
Yeah,
are some of these social determinants of health?
right. Okay, so let's go back to our previous example of the higher rates of infection amongst Black Americans than white Americans. So clearly, we've established here that there's a disparity. And I think the next important question to consider then is what is causing this disparity? And I think a study done by AMFAR found that counties in which white Americans hold a population total of more than 60% tend to have the lowest number of COVID-19 cases. So considering this statistic, one possible answer could be residential segregation. So although practices, like redlining have contributed to residential segregation, they have been illegal for decades. But it's really naive to think that their impacts on minority communities have suddenly diminished. They definitely have not. Those impacts still continue to be propagated. So when structural inequities supported by these practices lead to people of color having to live in areas in which they are in close proximity to one another, or where they don't have the option to work from home, that is reflected in higher infection rates with coronavirus. So what I mean by this, when I said that the pandemic is a mirror, is that it reflects back these realities of social determinants, and one of which is residential segregation, which we just discussed. And these play a significant role in affecting the health and well-being of our communities.
Yeah, and I 100% agree with you that um, although that some of these historical causes of these social determinants of health might not be in play anymore, their effects are very much still here, and it kind of puts people in a vicious cycle, which is what caused these issues to be propagated over and over again over generations. And it's really disheartening to see this kind of illustrated by the
Um,
statistics um, that you mentioned. Something that I'm kind of wondering um, is we can see how these causes and of social determinants of health and how these social determinants of health are very much prevalent in society and in communities. I'm kind of wondering where can we see these social determinants in the healthcare system and perhaps amongst physicians and healthcare practitioners. How are social determinants at play in that sense?
Yeah, yeah, that's also a great question, and I think as someone that's aspiring to, contribute in that field of study, I think that's something that's important to consider. So I think first and foremost, of course, increasing accessibility and quality of healthcare, that's a given. But I think it's also important to bring up a broader conversation in healthcare about what factors are contributing to poorer health outcomes that are seemingly non-medical. So in other words, are there social and environmental factors that should be considered when providing medical care? And I think these questions and conversations surrounding them are important to happen, are important that it's important that they occur in healthcare systems, because every person that's walking through the doors of a hospital are not coming from the same life situation and circumstances, and that's something that should be kept in mind when we're thinking about how we should address health inequities both within the healthcare system and beyond.
And that kind of really lends itself to my next question I have for you. You mentioned kind of starting these sort of productive dialogues concerning the social determinants of health, both inside the healthcare system and outside. Um, what I'm kind of wondering are what are some ways, including starting this productive dialogue, can are ways that we can begin to address these systemic and structural injustices as they relate to health.
Yeah, yeah, I think you're hitting on the question of the hour here, actually. So, with these injustices of systemic and structural scales, what is it that we can do to address them? And I think the answer actually can be found on two levels. So first, of course, we need to act on the very same scale. Policymakers, public health figures, we talked about healthcare professionals, and the general public alike actually need to take initiative to address issues. And these issues could be housing security or transportation access, and the general social determinants. We mentioned a few during our discussion here, but these social determinants play a huge role in propagating health disparities. And we know that we have to take action to diminish them. And we need to take that step and make sure that that happens. But also, I think what's important is taking a hard look actually at the attitudes that are held in our society that seem to fuel these health disparities. And, of course, we need to work to thoroughly dismantle discriminatory beliefs, because these can translate into policy and practices that end up hurting our communities. And these, can be referred to as the causes of the causes in a sense. So we, of course, need to put in the work as individuals and as a society to make this a reality. and there's no other way around it. So I think a big step that can help on this end of things is educating ourselves on issues such as social determinants. And, having these types of dialogues here is beyond important. And rather than looking for ways to, victim blame or shift the responsibility for calling for change onto other people, I think we all need to step up and do our part to bring light to the importance of addressing these social determinants and the factors and impacts that surround them.
That's exactly what I was thinking. I think you really hit the nail on the head with this. Um, the general public plays a huge role in kind of beginning the dialogue and kind of
Right.
getting the ball rolling in terms of kind of addressing these issues and hopefully fixing them. Um, I agree that we really need to not only focus on pressuring policymakers and bringing light to these issues, but also do our parts as individuals, which comes in the
Right.
form of educating ourselves, like you said, and kind of starting these productive dialogues, as you've been saying. Um, I think we're just running up on time here, so I wanted to actually, thank you for your time. You brought up some really interesting points, and you brought light to a really important issue. So thank you so much.
Yeah, thank you for your time, Mustafa. I really, appreciated having the opportunity to talk with you today, and just would like to stress, that dialogues such as these are what can be done by the general public. These are issues that need to be talked about, and having these dialogues can then translate over to, like you said, putting pressure on policymakers and doing things that are necessary to address these significant issues. So thank you.
Great. Thanks so much.